and welcome to the third segment of Leading with the Children, produced by Fortify Children's Health. My name is Heather Quillian, and I'm a pediatrician at Northridge Pediatrics in Charlottesville, joined today by Dr. Wendy Mason-Leslie. Wendy and I serve on the Clinical Care Committee of Fortify. Wendy, why don't you go ahead and introduce yourself to the group?
All right, hello everyone. Again, my name is Wendy Mason-Leslie, and I work with Pediatric Associates in Norfolk, Virginia. I also serve as Associate CMO for the Tidewater region for Fortify. I'm happy to be here to talk with you all just about the HealtheIntent platform and kind of how to use that platform to improve the health of the children throughout our region.
Awesome. Okay, so I think we'll spend the next 10 or 15 minutes or so just sort of talking through 10 practical tips for using HealtheIntent and the HealtheIntent registries. We hope that this will be helpful both to primary care and specialty clinicians alike. These tips, here they are in paper form, they are posted on the Fortify website, and reviewing them will count towards active participation for 2021, as will watching our recorded Zoom. So you all can attest to reviewing these, the tip sheet and listening to the webinar, on the Fortify website. So Wendy, you want to get us started?
Sure. So I'm going to share some slides with you all.
Perfect.
To start with. All right, so I figure the best place to begin is at the beginning. So really the first thing is to familiarize yourself or re-familiarize yourself with the functionality of the platform. So all the training resources and materials are on the Fortify website for you to review if needed. And these are straightforward introductions to the basics on how to practically use the platform, as well as introduction to value-based principles. If you have further questions, don't hesitate to contact any of us on the Fortify team, including Jim Plews-Ogan or Brian Thorne in Central Virginia, or myself or Suzanne Brixey in the Tidewater region. So in the Tidewater region, we're really fortunate to have healthy registries integrated into our Cerner EMR platform. So we can readily use Healthy Registry in daily huddles with staff prior to even walking in to see our patients. So slide 1 here shows the ambulatory summary view. So whether you're working out of this one or the summary view or the ambulatory workflow, you can see Healthy Registry components very easily on your screen and view them, review them with your staff even before you walk into the patient's room. One can also use Healthy Registries and go right into the platform by clicking the Healthy Registry button at the top of our page in Cerner there on that, that top banner bar. So Heather, I know this looks different for you in your region. So can you show us what this looks like for you?
Yeah, definitely. Okay, so at UVA, we have 2 ways to access Fortify. If you're already in a patient's chart, here, here in the plan section, you can click on the Fortify tab, which I've highlighted there. That will take you to a login screen, and you use your Epic credentials and your normal Epic password. And then you will come to the registry that that particular patient is a part of. So due to HIPAA reasons, Wendy and I couldn't really play around on the registries the way we wanted to with you. But I show this patient I had pulled up is part of 3 registries: adolescent wellness, pediatric asthma, and then pediatric wellness. So that's how you get into an individual patient. And then, but if the other way we can get it is just under the resources tab on our top Epic banner. You go down to the Fortify No Patient Context right here, click, and then it takes you to the Fortify Children's main website, which once we're in this place, it looks the same for all of us. It's just a different way to get there based on the 2 EMRs. But once we get here, we're in the same place. So I think that takes us to tip 2. So tip 1, as Wendy said, is just kind of refamiliarizing ourselves with the platform. And then tip 2, let me refer to our handy sheet, is to get reacquainted with the particular registries and the face-forward tiles that are available to all of us. So what I did here is I pulled up what it would look like for me when I pull up, once I click on that registry tab and Northridge Pediatrics comes up, because that's my practice. Here are all the registries available to me and to all the clinicians at Northridge. If I wanted to see my own, I could click here on this provider list, and the 5 of us who work at Northridge would pop up and I could go to my own particular patients. But I kind of think it's more interesting and more fun to look at us as a practice, since we're kind of all in it together. And then again, if you click on any of these tiles, they'll turn green. So I think in the next slide, I clicked on pediatric wellness. It turns green. If I double click, it tells me all the parts of the pediatric wellness tile. So what I thought was kind of cool or interesting or helpful during COVID was I went a lot to this well child in the first 18 months of life tile, double clicked it, made it green, and then hit on view filtered persons. And then all the patients in our practice that we are responsible for who weren't quite up to date on their well visits in the first 18 months of life, we could sort of reach out to them and bring them in. And I thought it was a nice way to close some gaps in care while people weren't coming in as much, especially earlier during the COVID things. So Wendy, I think that takes us to tip 3, right? Tip 3 is learn to use the view filtered persons.
Which you showed very nicely, and I'll show again in a future slide. So tip number 4 is to familiarize yourself and use the relationship tabs as well as the clinical information tabs within the HealtheIntent platform. So if you click on relationships, you can then see all the providers that have a relationship with that particular patient. And that's once you put in a patient name and date of birth. So here I just have a test patient there. If you click on the clinical information tile, you can then see lots of clinical information such as vitals, conditions, medications, and more. So what's really nice about both of these is that we can now get claims data, which we have never had before, into the HealtheIntent platform, so that if a patient has been to another clinic or an outside facility, you'll be able to see that information right here in these tabs.
Yeah, that's awesome. That will be helpful, I think. Yeah, there's so much cool stuff that this platform does, actually.
Absolutely.
I know. I had no idea before I started playing around with it. Okay, so tip 5, I think, is another way to make this kind of more interesting and fun for all of us. When we work together, it is more fun. I think, Wendy, even doing this, it has been more fun. So I would encourage all of you to, get together with a coworker, figuring out, just get on the platforms together and tool around. Maybe at a staff meeting, kind of come up with some questions like, has anyone found a particular aspect of the registries to be more fun than they thought they would be, or more interesting, or more clinically helpful? I think the more we all talk about it, the less intimidating it is, and the more we can incorporate it into our workflow, and the more we can use it to help us care for our patients. So that also brings me to tip 6, which is to ask for help, because when I first started doing this, I was intimidated by it. It's a whole new language. It seemed like one more thing to do. But once I started asking for help and had someone really show me around the platform, I realized that it was a lot of information right at my fingertips, and it wasn't overwhelming. It wasn't torture by 1,000 clicks. It was really like, it added to my practice, I felt like, in a fun way. So I'm hopeful that that will be true for all of you watching. All right, Wendy, take us to tip 7.
All right. So
I was going to say one thing about tip 6. In terms of asking for help, every practice has a clinical champion. So you can reach out to that person for sure. You can email, what is it? It's on the tip sheet, but it's support@fortifiedchildren.org with any questions. I'm also, super willing to field questions. I'm by no means an expert, but I'm always happy to try. So I think asking for help and working together is going to make this a lot more fun.
You're absolutely right on that one. And it builds that camaraderie. You feel like you're not alone in it when you can share it with your partners.
True.
So tip number 7 suggests using HealtheIntent for outreach. So one can do this by using the HealtheIntent platform to generate lists of patients, like Heather was saying a little bit earlier, who are not meeting specific metrics, and have your staff call those patients and bring them into the office. So one thing that was really, I think, timely is that during the downturn with COVID and our patient numbers or patient visit number, the Fortify team created job aids, and this is one of them. This happens to be the asthma registry job aid, which was step-by-step instructions on how to use the Intent platform to generate lists of patients. So like Heather showed earlier, you could click on a tile and then click View Filtered Persons, and then you would be able to generate a detailed list of patient information, and then use that list to outreach to families and get them into your office. So I just want to share, go ahead and share the last several tips here. So tip number 8 is to ask a curious question, which means to think about ways to use the HealtheIntent platform that would help your practice. Maybe that's to prioritize outreach, or even consider a QI project. So just asking a question is a wonderful way to utilize.
Yeah, I think so. And I do think that kind of brings us to tip 9, which is to kind of work together within our practices to brainstorm how we could use the power of the platform to help us organize some QI projects. Like, would it be, how are we going to increase how we're doing on our teenage depression questionnaires? Like, we think we're doing a good job with the PHQ-2 and 9, but are we? And can we think of some easy ways kind of to do better, or whatever it is that's interesting to any individual practice? I mean, I think that's what's going to be kind of interesting, is we all have things we do really well, and then we all have things that we could improve on, right? I mean, that's just the nature of the beast. And so this is an easy way for us to know who we're responsible for, how we're doing in terms of what we're responsible for, and design some cool QI projects that are meaningful for our own individual practices. No one's going to tell us what to do. We can figure it out ourselves, which I'm actually excited about that part of it. All right,
Excellent.
Take us to tip 10, Wendy.
Tip 10, consider training the rest of your team about something you have learned, like data available for QI, or perhaps a specific measure in a registry that you found extremely useful, or just using that filtered persons tab to come up with a list. Again, involving other people can really make a difference and create that sense of camaraderie.
I know. I think that is one of my favorite parts about this, is getting to know people across the state on Zoom, but hopefully someday in real life,
That's right.
and working together. So, we both hope this has been helpful for you all. Please check out the resources that we mentioned. These are on the Fortify Children's website under Member Resources, tip sheet, and then a recording of us. And reach out with any questions, any suggestions. If there's anything that we can do, please feel free to reach out to us.
Thanks again.
Yeah. Bye, Wendy.
Bye.